Welcome to South Australia's daily COVID-19 update. Today I'm joined by the Honourable Stephen Wade, the Minister for Health and Wellbeing, Professor Nicola Spurrier, who's the Chief Public Health Officer, and Police Commissioner Grant Stevens, who is also the State Coordinator during this major emergency declaration. 2 weeks ago today, we were facing a real battle here in South Australia with the knowledge that we had a case at that point confirmed at 2:30 a.m. Of the Delta variant, and I think everybody now knows what happened thereafter. South Australia went hard, we went early, and we now find ourselves in a very changed situation here in South Australia. And that changed situation has led to the Transition Committee providing advice to further gradually reduce restrictions in South Australia. And I'd like to outline those to you this morning. We are still concerned. Yes, it has been 14 days. But if we have missed any cases in South Australia, we would be picking them up around about now, and so we really do need to just be a little bit careful for the next couple of days. So these changed restrictions will come into place at midnight on Wednesday night, so as of Thursday, a different arrangement. And that is as follows. We move back to 50% capacity, so 1 per 2 square metres here in South Australia. We move back to 1 per 4 square metres in gyms in South Australia. Sports can return for competition, although there will be some conditions with regards to the number of spectators that can go to all of those competitions. The Police Commissioner will go through with that with us later. We are going to continue with the current arrangements regarding masks. We know that this particular Delta strain is airborne and the transmissibility is very often airborne, and so we are at a heightened risk, and so we will be keeping with masks as we've had them for the last week for the foreseeable future. So that's making sure that we are wearing them in all high-risk settings, personal care, public transport, and also in indoor public spaces when we're with people that we don't know, or maybe even in an office situation where we might be at the water cooler, at the photocopier, or in the lunch room. We're also going to keep the home gathering cap at 10 for our changed arrangements on Thursday this week, and singing and dancing restrictions to stay in place as per level 3. Schools will keep their mask arrangements in place, but we will be returning to excursions and assemblies as captured by the Chief Executive of the Department for Education from Thursday. So he has put out some advice with regards to what hasn't been allowed with regards to assemblies and excursions, and that will be the new arrangements will come into place as of Thursday. So I know a lot of families and students, teachers and the principals will be very happy about that. With regards to the border restrictions, you would have noticed that on the weekend we did increase the buffer and change the testing arrangements for those people living in the cross-border communities between South Australia and Victoria, and in particular we took that buffer out to 70 kilometres, changed the testing regime. As of today, we make a further change, which is with regards to sport. We were asked over the weekend to consider some of the reasons why people can move from one side of the border to the other. Historically, it's been for school, for shopping, medical or work-related purposes. We'll be adding a further one this week, which is for people to attend sport. We recognise that in the country, competitive sport is very important to mental health and well-being, and so that will take place. When the new direction goes through. And also, I suppose, and most importantly, we still have a large number of people in Queensland, South Australians in Queensland. Now we currently have level 6 arrangements in place for Queenslanders wanting to come into South Australia. They're not permitted. South Australians can return home at the moment. If they're in the southeast of Queensland, they need to do 14 days of home quarantine. If they're in other parts of the state, well then they need to have that testing on day 1, day 5 and day 13. Now I think we need to all recognise that there could be a changed situation in Victoria. People need to be flexible. If they can return to South Australia now, this would be our advice. We don't know what this week is going to hold in Queensland. We know that the lockdown in South East Queensland has been moved from 3 days right through to Sunday this week. And so we're saying to people that at the moment, South Australian residents in South East Queensland can return to South Australia and complete 14 days of home quarantine. And this is something that everybody should consider at the moment, because there is a possibility we could move to level 6 restrictions for South Australian residents, as we have with those people in New South Wales. Can I finish off by saying a massive thank you to all South Australians who have abided by the restrictions that have been put in place over the last 14 days. Your action, your willingness to work together has really put us in an enviable position. The mask wearing this week has really given the Transition Committee, the Chief Public Health Officer and the Police Commissioner a great cause for optimism, and also this was one of the key reasons why they were keen for us to further step down restrictions in a gradual, careful and prudent way, but in a way that will provide greater freedoms as of midnight this Wednesday night. So over to questions, and then I'll hand over to Professor Nicola Spurrier, who will provide the details with regards to any new cases.
Does that 50% capacity change the limits for weddings and funerals?
No, I think the caps remain for weddings and funerals for this week, so we'll have a further update on that.
The rules with Queensland, is that just for South East Queensland? What about residents in other parts?
No, it's South East at the moment, but you would have seen that there has been a case in Rockhampton, so if you have been to that exposure site, there would be a higher level restriction. But if you've just been to Rockhampton itself, not at this stage. But I'm just asking people to consider that there could be a changed situation in Queensland this week. More cases today. We have every faith in the Queensland health system and the government there to get on top of this cluster. But we are in a pretty tough situation around the world with the Delta variant, and people just need to be thinking now about whether or not they should be staying in Queensland or coming back. If we put those level 6 restrictions in place for South Australians, it makes it very difficult. We do have a large number of people who are still in New South Wales at the moment, and we're trying to work through how we bring them back in the most time efficient way.
Just a question on that. When you say that you could bring in level 6 restrictions for Queensland, at the moment, people, South Australian residents wanting to return from New South Wales are still allowed to, aren't they, through the health exemptions? They can still return if they apply.
Well, subject to an approval via that exemptions process. But I think what we did was, several weeks ago, we said you can make an application for exemption if you tell us where you're going to stay, when you can come back and you can essentially do your home quarantine. That's not the situation at the moment. They need to make an application for an exemption, and SA Health really need to be quite positive that people are going to be able to very carefully and strictly observe that quarantine situation. So very few exemptions are being granted at the moment. It is a particularly worrying situation in New South Wales with this Delta variant, the current cluster, and of course the numbers continuing to go up.
Is that the test though, that you just need to prove that you have somewhere to quarantine? Because when you do call the COVID hotline, and this has been on several different occasions, the message has been clear that if you are a returning SA resident, you can come back. You just need to prove that you are an SA resident and that you can quarantine.
Well, we've dealt with this at many press conferences over the last fortnight, and as we said, it's not an automatic. So originally it was sort of almost a tick or flick. You said you had somewhere that you could effectively isolate, and we accepted that. That's no longer the situation. There's a very high level scrutiny, and very few are getting through at the moment because we are on high alert with New South Wales. The only real changes to that is if somebody is coming through the New South Wales airport, so they might be coming in from Brisbane or far north Queensland to Sydney and then to Adelaide. It wouldn't be the case for people moving from Sydney into the Sydney airport coming to Adelaide. Look, we're very concerned about the situation there. The lockdown that we had over the last couple of weeks was caused by somebody coming from New South Wales into South Australia who had the Delta variant, and you can just see how quickly this spreads. So we are very prudent at the moment with regards to our borders, and that is likely to be in place for quite some time.
I was just asking.
Daniel Chaffee, been quite scathing of you on radio this morning, saying clearly you have the power to help him get here to see his mother. Surely you come above health bureaucrats that are there to sign off. Why can't you make this or push this through for him?
Well, look, I seek advice on every individual case that comes across my desk. I think there's more than 4,000 South Australians who are trying to come back into South Australia at the moment.
But to see dying relatives, 4,000 people, how many people are in his particular
I'll just
situation?
finish my sentence. Thank you very much, Elspeth. But the situation is I have more than 4,000 people South Australians who are stranded overseas or interstate that are trying to come back. We do try to triage as many of those as quickly as possible and put it through to SA Health. But ultimately, SA Health need to make that decision based upon the clinical advice and also the risk that every individual situation poses. I don't think we would accept in South Australians that politicians should override that expert health advice. We have had, since day one in South Australia, a situation where this has been our methodology and it's served us particularly well. Now, a lot of those cases, more than 4,000 at the moment, are people wanting to return home for various reasons. Relocating, people who have got compassionate reasons. They haven't seen their family for a long period of time. Many of these situations are absolutely heartbreaking. But we've got to balance all of the information that we have and make the best decisions for our state. And these are tough decisions. This is not an easy job, and the exemptions process is, I think, a robust process, and it serves South Australia well.
I guess the problem with this is an exemption has been granted to Mr. Choffey's stepsister on the same clinical advice, and she's coming from New South Wales. When we heard from the Professor Spurrier last week how that's been considered as dangerous as coming in from overseas,
Yes.
Why is Mr. Choffey being denied an exemption on the same clinical diagnosis?
Well, look, I'm sure Professor Spurrier will go through that, but we've got to also be a little bit careful. We don't tend to go into a lot of detail with regards to specific applications via the media for a range of privacy reasons. What we do, though, have is rules in place at the National Cabinet level that when people come in from overseas, they need to do their 14 days of quarantine at the port that they arrive in. So this is a national rule that has been in place for a long period of time. So if Mr. Choffey had have come into Adelaide, then it would have been far easier to work out how he would visit relatives here in South Australia. That wasn't the case. He went into Brisbane, and so it is a changed situation. But I don't plan to navigate this entire case because ultimately the decision is one that rests with SA Health, and I back SA Health 100% in the tough work that they have to do, looking at all of these very often heartbreaking situations.
Why did you write the letter for him? Why did you write the letter for him, Premier? Why did you write the letter for him, and was it appropriate?
Sorry, I'm just answering Andrew's question,
but
Stacey, but I'll come back to yours. But
Okay.
just because you're yelling the loudest doesn't mean that I'm not going to deal with Andrew.
Just
Thank
making
you.
sure you can answer them, that's all.
Premier, has the system overall, not talking about the specific case, have we lost sight of compassion? Have we lost sight of of showing some heart to people who are, his mum is not quoted terminal, that's what our understanding is, but is there any sort of compassion that we can show to these people in these times?
Absolutely. Look, can I just say, there are so many heartbreaking stories where people have been dislocated from their families. They have had to suffer reduced numbers at funerals cancelled, weddings cancelled. There are so many sacrifices that have had to be made. And yes, you do have to show compassion at every opportunity, but you've got to weigh that up against risks. And we don't do that from a political perspective in South Australia. We have left that to the people who are the experts in processing those exemptions. And to Stacey's question, yes, of course I wrote a letter because Mr. Choffey wanted to come back into the country, and we have to have an exemptions process to allow people to come into the country. So of course I wrote to the Home Affairs Minister saying, look, this is the situation as it was provided to me by the Choffey family. I was very happy to write that. In fact, I think I received a request to write it, and I might have written it the same afternoon, but that's a different matter to the matter associated with the exemptions process in South Australia, which we leave up to SA Health.
I guess the problem here is that the Queensland government has granted that exemption for him to leave quarantine, and it was out of his hands coming to Brisbane. Because
I'm more than
went
happy
into
for
lockdown.
Professor Spurrier to follow up, because I've sort of given all the information that I've got on the process with regards to the original documentation which went through to the Home Affairs Minister, the way that we deal with it in South Australia, and it has been the way since day one. And I don't think anybody is actually advocating that we should basically trash what we've done in South Australia since day one, which is leave these decisions to the experts. It's served us extraordinarily well, but I do say that, of course, this is a really tough role that SA health exemptions have got. Nobody would really want this, because what you're reading on a daily basis are heartbreaking stories. But again, I just say, so many people, individuals, families, businesses have had to make sacrifices here in South Australia, around the world. But it is these individual sacrifices that have kept us safe and our economy strong in South
Do
Australia.
we have an issue with the vaccination of our ambulance service?
Well, I don't know what you mean problem.
There's less than 50% of SAS workers are vaccinated. Is that an issue?
Well, look, obviously from our perspective, we're wanting to get as many people as possible vaccinated. I don't have any specific information, maybe the Health Minister might, on SAS employees, but many of them would be very eligible at the moment to go and have that vaccination, but what percentage, I've got no idea. And I don't know whether it's a single shot versus double shot. Obviously we have a constraint in Australia. We're all more than aware of the constraint that we have, which is the number of doses that we have available. In South Australia we are pretty much in sync, in balance at the moment between the supply that's coming in and the demand of people presenting themselves. I do strongly emphasise just about at every single press conference that I do, that when you become eligible, our strong advice is to book in for that vaccination, because that's going to be what keeps yourself safe, and also your family, your community and our overall state safe. But I'm happy for Minister Wade to maybe look at that question.
Just to be clear, so you felt it was appropriate, just back onto Daniel Choppy, to write a letter helping him get into the country.
Yes.
Whereas you're not willing to use your position to help him get into SA.
I don't have anything further to add.
But what's the difference between writing a letter to help him get into Australia? But now that he happened to land in Brisbane, you can't help get him that extra leg here to see his mum.
I've sort of been through this. They're two separate things. One is, for somebody that is overseas to come into South Australia, they need to get an approval from the federal government, from the Home Affairs Minister, Karen Andrews. So, of course, he had a compelling issue to come into Australia. Now, if he had come into Adelaide, then it would have been a very different situation.
That's why it's called an exemption, a compassionate exemption. Why can't you speak with people here and make it happen? Why can't the same letter be written to SA Health from you?
Oh, look, just to be very clear, my office has communicated with SA Health, but we also don't politically interfere in the exemptions process. It doesn't mean we're not advocating strongly. Obviously, it's a compelling situation, but a political office doesn't have the clinical information necessary to make the decision. They obviously can advocate on behalf of constituents, on behalf of people of South Australia for an outcome, but ultimately I think in South Australia we've got to leave it up to the clinicians to make these tough decisions. If you start having politicians saying, well, look, we know better than the epidemiologists with regards to this, you can start to get some pretty, I think, poor outcomes for our state.
But you'd like for him to come into Australia?
I don't see the point, because I've sort of made it clear they're two separate processes.
Can I just ask you, sorry Harvey, can I just ask you on back to the restrictions, and forgive me if you have touched on this, seated consumption, is that what is going forward?
Continuing, yes.
And therefore, how long do you envisage these set of restrictions staying in place for?
So that is something that we need to look at almost on a daily basis going forward. It is a very difficult situation that we're now encountering right around the country. The situation in New South Wales is worrying, and it's now persistent. The situation in Queensland is worrying, and it's a deteriorating situation there. So I wish I could provide greater certainty on a daily basis. People saying, look, we need certainty, we need to be able to plan. It is very difficult. We're in a pandemic. There's nothing neat and tidy about a global pandemic. Things move around very quickly, but obviously we stand by our policy position right from day one, which is we don't want to have these restrictions in place for one day longer than we need to. But at the same time, there is a much higher transmission potential in South Australia now, courtesy of the fact that we have that Delta variant in New South Wales, in Queensland, and as much as we try to secure that border, it is still reasonably porous.
I was ask you about the National Cabinet meeting on Friday. We haven't had a chance to ask you since. We now have the plan forward, the 4 phases.
Yes.
What does South Australia's plan look like? I know Sydney's saying we can have 70% vaccinated in 5 weeks. What are we going to do here?
Yeah. Well, so we had a lengthy meeting of the National Cabinet on Friday afternoon. It started at 1:30, it finished after 4:30, so it's an unusually long meeting, but I think it was a really important meeting. We received presentations from the Doherty Institute, and we also received a presentation from Dr. Stephen Kennedy, who's the Treasury Secretary. I think the key things that came out of it for me were it's now very, very clear that from a health perspective, but also from an economic perspective, going hard and going early has the best health outcomes, but also the lowest cost to the economy. So that is now the unequivocal advice that's coming from the Doherty Institute and from the Treasury Secretary, Dr. Stephen Kennedy. In addition to that, what we agreed was on a broad framework to move through to a situation where we continuously ease the restrictions. So we're in stage 1 at the moment. There are 4 stages, 1, 2, 3 and 4. To go from stage 1 to stage 2, we need to have 70% of our adult population twice vaccinated, and to go from stage 2 to stage 3, we need to have 80% of our adult population twice vaccinated. Now there, I don't have the details for me, but you would see it now, the various stages. But really, that's the advice that we received from Doherty with regards to what those thresholds should be. Now, some states might say, well, we can get everybody vaccinated very quickly. What I would say is that we in South Australia have our situation in balance. We will be getting a very significant increase in the Pfizer vaccine coming into South Australia at the end of this month, and we'll start to see that number increase in our state. Look, I think that we are in a situation where we now have a framework which provides hope, it provides a pathway out, but it's not going to occur in the next 3 or 4 weeks. So I think people have got to recognise that there are some pretty tough months ahead. The Delta variant is highly transmissible, and that means that we have to be on high alert. Even as we come out of the restrictions that we've had after our lockdown, we still need to all be very, very vigilant. If anybody develops any symptoms now is the time to go and get yourself tested. The lines are non-existent virtually in our testing facilities in South Australia. If anybody is out and about, we're asking them to QR code check-in. This allows us to move very quickly if a new case is detected in South Australia. And as I said before, making sure that you can get vaccinated at the earliest opportunity is a high priority.
Could you just clarify masks? Are you saying now just assemblies and excursions and not in the classroom? Could you just clarify masks in schools again? I didn't quite get
No, masks in schools remain the current situation. The easing with regards to schools wasn't with regards to masks, it was just that assemblies and excursions can now occur. So what we did last week, we said, all right, we're back to school, but for the time being, we're not going on excursions, we're not having assemblies, and there were other restrictions put in place in terms of parents coming onto the campus and in terms of teachers that come from outside of the school going onto the campus. All of those things will be confirmed with the individual schools, but with regards to masks, we are asking the students 12 and over to continue wearing the masks at the moment.
Could we please, Nicola, just because you've got HPPC?
If we do, I've got a couple more for you afterwards though, if that's
I'll be
all right.
back.
Thank you.
Thank you and good morning, and I certainly will give more information about the Choffey family, but I do want to give an update for South Australians about where we're up to with the Modbury outbreak. So things have gone very well, and I have to thank every South Australian for doing all of those things we asked you to be wearing the mask, getting tested if you have symptoms at all, and also those people that were required to quarantine for 14 days. There are still some people in quarantine. We're looking at all of those day 13 tests so that we can release everybody from quarantine, and that's what my team is chasing up over the next couple of days. So if you are due your day 13 test, please make sure that you go and have it, or else you'll get a friendly reminder from somebody in our team. So we do have one new case today. It's a child who arrived from overseas and has been in the Medi Hotel hotel with her family. And indeed, we still continue to have cases in our international arrivals. And this is one of the reasons why we are very strict about quarantine for international arrivals, and we do not, as an AHPPC committee, we do not support people transferring between states when they have come from international ports and they come into a particular state. So the child is a historical infection and is linked to cases reported yesterday. This gives us 28 active cases in our state, 21 cases linked to the Modbury cluster. There are still 3 people in hospital at the Royal Adelaide, but they're all stable. A man in his 80s, a female in her 80s, and a female in her 50s. Now, we had nearly 11,000 tests done yesterday. We really are still on high alert because it's only just been recently that we got the Modbury outbreak under control. The team did an amazing job at getting so many people notified, tested, and into quarantine. But there's always a few people that haven't used the QR codes, and I might be talking to some of you. You might have forgotten on the odd occasion. So there's always a chance that there is a case in our community, and it's very important that the take-home message today is if you get symptoms at all, even if it's really mild, that you go and get tested. And please make these your friends. Wear your mask. If you can wear a mask, wear a mask. And the Police Commissioner will go through some of the lifting of further restrictions on Thursday, which I also look forward to. Now, I will mention, give a bit more detail about the Chofie family. And just to put this into context, this is one of the many, many, many very sad situations that we have had to look at over the pandemic. And indeed, it's very unfortunate for this family where their mother has been diagnosed with, unfortunately, a terminal medical condition. But it is not end of life just at this point in time. So it was very appropriate for the Premier to write to the Home Affairs and to allow the son to come into Australia. But when we look at our exemption process, it's actually about letting the individual who's in quarantine go into one of our hospitals. And obviously when you go into a hospital, there are vulnerable people there, there are patients, there are staff, and we have to be really sure that it's necessary. Now, in this particular instance, and this is done, and we do this all the time, we make contact with the clinicians involved. In this particular instance, in fact, Mrs. Chofie is stable. I'm not saying that she hasn't got a devastating diagnosis, and I'm not saying that this has had a huge impact on her family, but she's received excellent care in the Royal Adelaide Hospital. She's stable, and in fact this morning, talking to the clinicians that we do on a daily basis, they're even considering some discharge options for this woman, which I'm really pleased about. I'm pleased that she's getting better. So it's very likely when the gentleman finishes his quarantine in Queensland and when he comes down to South Australia, and I think that's likely on Saturday, the dates I was given, it will be around about the time that Mrs. Chofie may even be getting ready to go home. And when we look at all of these sorts of things, because of course this is not the only family, there's been many families in similar situations. We do allow some people to make end-of-life visits, but it has to be truly end-of-life for us to take the risk, and that's a risk for the whole of South Australia, to take the risk to allow those sorts of visits. Those visits are done with full PPE on everybody, staff, the patient, the visitor, and a sterile corridor. It's not a minor undertaking, it's a very major undertaking, and it is all involving some risk. In this instance, and again, we do this regularly on a daily basis when we have these requests, we go through whether or not it is considered end of life from our perspective. So my heart goes out to this family. And it's very challenging when we see these pictures and this information about this particular individual on the news. But I want to reassure South Australians that we have looked at it, we have spoken to the clinicians, we keep in contact with the clinicians, and we monitor the situation very, very carefully. Now, I was told that in fact, I think it's a daughter-in-law has come over from New South Wales and is quarantining in South Australia. That person will not also be allowed into the hospital. So they are not being given an exemption out of quarantine, and the same situation applies to this woman's son. Now, it must be terrible for this young man up in quarantine thinking about his mother, but I'm hoping that the family can really provide some support through phone and through video conferencing, and I think it'll be fantastic when he is able to get here. But at this point in time, even if he was in South Australia, he wouldn't be allowed to go into the hospital to have an end-of-life visit. So hopefully I've covered everything that you already have asked the Premier. We don't normally give out these sorts of details because every patient deserves their privacy, but I do understand that the family have gone to the media in this particular situation. So happy to take any further questions. Very happy that we've been able to lift some restrictions here in South Australia, but the situation both in New South Wales and now again in Queensland have become very serious. We still have a very significant risk. When we sat with the Transition Committee this morning, we had a look at the sort of numbers of people that come from those states. And in terms of New South Wales, there's somewhere between 400 and 700 people come from New South Wales every single day. Majority of those are freight, but of course there are other reasons that we allow people into our state for compassionate reasons and such like. So very happy to take any further questions.
On the showdown, can you tell us, is there any decision there, and can we expect crowd numbers at some sort of capacity? Have you got any idea?
So we are working with the Adelaide Oval and the AFL. It will be in line with our general restrictions as we've outlined going forward. We do have to be very careful with stadiums. Unfortunately, there's been transmission events both at the MCG and the AME Stadium in Melbourne. We had always thought, certainly with the previous variants, Alpha and the Wuhan, that stadiums are pretty safe because mostly you're outdoors, and I am so glad that the Adelaide Oval has been so helpful at keeping masks on patrons. So we'll be looking at risk mitigation. We're working through it, and we should have more to say later this week.
Professor, when it comes to Mr. Joffe, what risk is there when he has tested negative 3 times, has had one first shot of Pfizer? Do those things, are they considered, he's got a charter flight here, are those things being considered when it comes to this exemption process?
Look, we have to have consistency for every single family that is in this sort of situation, and it is, it's sad that this is not the only family that we've had to deal with. But where Mr. Joffe's come from, they are seeing hundreds of cases of COVID a day, and I'm not prepared to take that risk, indeed nationally, but also for our own state.
Professor, I asked the Premier this, and I appreciate what you were saying about how your heart goes out to the family. Is the whole exemption process lacking in compassion at all?
Oh, not at all. They're the most compassionate group of people I know. It's actually a really tough job. We've got senior clinicians, senior nurses and senior doctors who look at these cases. These are doctors that have work with patients. We've got people who work in ICU, we have people who work in the emergency department. We have people that deal with families and patients in a clinical setting on a regular basis. So there is no way that they would lack compassion.
I know what Daniel says. He says, you want my mum to be more terminal.
Certainly not.
He wants quality time with his mum.
I am so pleased actually to have this good news that Mrs. Joffe's improving. She's had treatment, she's had surgery, and she's actually improving. Obviously, it is still a devastating diagnosis for this family, and the sooner that this man is reunited with his mother, I'm sure it'll be fantastic for him.
Professor, are you concerned that there are health workers within our health system and in the ambulance service who aren't vaccinated? Less than 50% of our ambulance workers are vaccinated.
This is obviously concerning. We know that anybody who comes in contact with a COVID patient, their best protection is to be vaccinated. PPE aside, it's very important to be vaccinated for your own individual protection, but also for our community protection. We have done a huge amount of work making it as easy as possible for our healthcare services, anybody really in a red zone to be vaccinated. And as you're aware, we do now have a direction in place that will require people, if they come in contact with a COVID patient, i.e. be in a red zone, to be vaccinated.
Professor, could I ask you, your health advice to the Transition Committee this morning, did it recommend the restrictions that have been announced?
Oh, look, it's not for me to talk outside of our the transition committee. I provide a range of advice. Some of the advice is, and I've actually just provided it to the South Australian community, is it's early days from the Modbury cluster. There's still potentially people that may have been exposed, but we don't know about you. So anyone who gets any symptoms in South Australia, you need to get tested. It's our only way to know that we've really got on top of this.
So can I therefore,
when
can
do
I
you
just-
meet again? When does the transition committee meet again? And do things like capacity, hospitality, would that be on the agenda again? Obviously, we know they say they can't break even at 50%. They need 75. They need stand-up drinking. When might we see that back in SA?
I actually can't remember. My diary's pretty packed exactly when the next meeting is. Sorry, Elspeth. But we do look at this, but we need to look, we've got to take a bigger picture view. It's not just what's happening in South Australia and the great job we've done here. We've got New South Wales, a major problem. We've still got significant numbers of people from New South Wales coming into our state, and Queensland now an issue. The Delta variant has changed the landscape. It has made it a lot more difficult, and really this is the fact, until we get the whole world vaccinated is how we're going to stomp this out. But suffice to say, the Transition Committee meets regularly, sometimes meets on the weekend, it meets when we need to.
What will it take for the next step of easing of restrictions, particularly in the current environment, for things like weddings and funerals and density?
The weddings and funerals, I think we can move a little bit more quickly on. The density it is one of our brakes on that rapid spread, and the New South Wales outbreak has not shown really much halting at the moment. It certainly hasn't become exponential. They've certainly done a good job at flattening the curve, but the real risk remains. And we already know in South Australia, that's why we had to have a lockdown. So we've really got to keep a close eye on that. That's my major concern at the moment, and obviously Queensland.
Professor, are you happy with the overall vaccination rates, particularly in the younger cohorts?
When we can open up to 16 to 40-year-olds with Pfizer, I will be absolutely overjoyed. But everyone knows in Australia that we still have constraints on supply. But as soon as we get it, I want to get it into everybody as quickly as possible.
Do we know when? Any rough idea when that might happen?
You'll need to have a look at the national rollout. My understanding it's September, October.
And will that be opened up to 16 to 40s, the big age group, or do you expect to open it up in stages?
We're working through that at the moment, and as you know, this is a Commonwealth program as much as anything else, but I'm certainly very keen, as we have done in our regions, to open that up as broadly as possible as soon as we've got the vaccine.
Sorry, are you at the point where it comes to that national plan, the 4-phase rollout, of applying a timeline in South Australia of when we might hit phase B?
I think it's really too early. It's just baby steps. Let's get everybody vaccinated first, and then let's see what else we can do. What's next on the
Professor,
horizon?
Can I just ask you back to the Chofie case, if I may. Has this information about the improvement to Mrs. Chofie's condition and that she might be going home, has that been communicated to the family? Because we've got information that says that it hasn't.
Look, I would absolutely assume that this information has been provided to the family. There are people within South Australia that I think indeed are supporting this woman at the moment. The Royal Adelaide Hospital and the doctors there are world standard, and that will include their patient communication.
And how many people are still in quarantine from the Modbury cluster?
I haven't got those numbers for you, sorry Harvey. I'll see if I can get something a bit later.
And sorry, Professor, could I just ask you as well, do you support the whole vaccine passport scenario in allowing people that have been protected either first or, but most importantly, second dose from having a greater freedom from restrictions than, say, those that don't?
I think at the moment we've just got to try and get everybody vaccinated, because that's indeed our way of reducing the risk of an increasing outbreak if we get seeding in our state. So that's really my focus, on making sure we get to that 70% and we get to it as quickly as possible.
Commissioner, can we ask you a question, please? More changes today to restrictions. How does this change? How do you guys have to adapt so quickly to now police changes in capacity, changes in masks? How does this affect the police force?
Oh, well, in the first instance, we have a team that are now working on a new direction, so they'll be constructing that now. And we'll be pushing that through to our frontline police officers so they understand what the rules are. At the same time, obviously, it has to be communicated to the different parts of the South Australian community that can now adjust in accordance with those new changes. So the freedoms that come from relaxing restrictions don't have a direct impact on our frontline resources. We are still out there monitoring compliance, and all the signs are that compliance has been excellent. The big issue for us comes from our border checkpoints and controlling people coming into South Australia. That is quite resource intensive, and at the moment there's no direct impact because we already have those checkpoints in place, but we'll be closely keeping an eye on that to make sure we have the right resources in place. As the Professor has said, it's a major concern for us, New South Wales, so we are looking at our border restrictions to make sure that we are managing those people coming into South Australia so that if they are permitted to come in, they do so as safely as possible.
Are you saying, are there any extra checkpoints that you're going to be manning, or is it still the same, or I'm talking obviously on the road, that is?
So our border checkpoints on the road entry points, we currently have all of those covered for New South Wales and for Queensland. That's very limited up in the top end. We do have some presence down in the southeast as well. We don't have to introduce any more checkpoints at the moment, but what we look at is making sure that we have ample coverage to accommodate most people trying to enter South Australia so we can process them in accordance with what they're allowed to do.
Can you please outline the
Can I just ask
changes?
you on fines, have there been any more significant sort of breaches that you could give us an example of about, people flouting mask wearing or not checking in?
Yeah, certainly. I don't have the specifics of the location, but there was a woman police were called in relation to a woman creating a disturbance because she wasn't wearing a mask in a supermarket. Police attended, directed her to put a mask on. She refused and she was given an expiation notice. She was then directed again and again refused, so she was arrested for breaching the emergency management directions. And there was a male who snuck into South Australia from New South Wales. We identified that person and he was arrested and he'll be appearing in court. I don't have the specifics of each case, but they were the two most recent breaches that I'm aware of.
Can you outline the changes for community sport? What does this mean for school sport this weekend?
School sports are included in the resumption of competition. With community sports, there will be a restriction on spectators. It really comes down to spectators being limited to those people who are there to provide care and supervision for children or players, but we are discouraging crowds at competition sports at the moment. We want the competitions to get back up and running so that they can finish their seasons, but we need to limit the level of activity we see around those events.
Given how well Victoria's going, is the border there in discussion about dropping the hard border with Victoria?
We did discuss the arrangements with the Victorian cross-border situation. As the Premier highlighted, we have made a minor change to cross-border communities. We did have a look at whether or not there was scope to shift in relation to the restrictions we have for people travelling from Victoria into South Australia. At this time, no change, but it is continues to be on the agenda, and we're monitoring how Victoria is going at the moment. And we are looking at the difference between Greater Melbourne and regional Victoria, but no change at this time.
And what about Broken Hill? Are we going to reinstate the bubble with Broken Hill?
We already have an arrangement with Broken Hill that lets people who live in the local government area of Broken Hill travel into South Australia, and South Australians who live within a certain distance of the New South Wales border are permitted to travel into Broken Hill because it's probably the closest regional centre that they can visit for essential supplies and services. We're not changing that at this point in time.
Commissioner, could I just ask you on the caps on gatherings and weddings and funerals, could you explain the rules when it comes to what the cap is for weddings and funerals going forward, please?
I don't remember the exact number for weddings and funerals, but there has been no change from what the current situation is. That's a carve-out for private gatherings because other private gatherings are quite limited. So we'll maintain that for another week, and as Professor Spurrier indicated, that's one of those things we think we can probably make a move on through the course of the Transition Committee meetings over the next week.
And can I just follow up from that? Are we saying that these current crop of restrictions that you've announced or that are being authorised from Thursday, is that going to be another week, or do you have a sort of time frame of when they'll be reviewed again?
We don't put an end date on our directions, so really they remain in effect until they're overridden by a new direction. I wouldn't imagine that we are going to make wholesale changes prior to a week. We would be aiming for about a week, but it's a continual reassessment, and if we do see significant factors that allow us to make those changes, we certainly will. But for people's sense of surety, I would say we'd be looking at a week at this point in time before we made any further steps, but it is a daily consideration.
And I asked the Professor this, did you have to make any overruling of health advice with any of these decisions?
The Transition Committee today, it was probably one of the more robust meetings that we've had. It went for much longer than we anticipated, but we did cover off on a lot of issues, both relating to public activities, school-based activities, our borders, and the current situation in other jurisdictions around Australia. Professor Spurrier provided specific advice. It was the subject of discussion, and at the end, the recommendation to me from the Transition Committee wasn't the subject of any dissent. So the advice to me was unequivocal.
Sorry, just forgive me, Commissioner. The advice that went in, that you were given, did it recommend that density changes before the robust discussion within the Transition Committee, and then you make your decision?
It made some recommendations for change, but it wasn't entirely consistent with where we ended up after the discussion.
The Premier's talked about mask wearing being a key to lifting restrictions. You must be pretty happy with the compliance for masks. Even people walking outside, it seems everyone's doing it.
Yeah, I've got to say it's something that's demonstrated to me just how seriously the South Australian community takes the risk of COVID-19, and particularly this Delta variant. It shows, I think, a great sense of community that invariably everyone is doing the right thing, and it does give us the confidence to manage risk in a different way and to maybe take a step further in terms of relaxing restrictions than we might ordinarily take, because we know that the community is doing the right thing. They're supporting us in the decisions we're making, and it provides confidence. So it's really important that people are doing it, and I'm grateful to see so many people readily accepting this imposition at this point in time in places where we haven't mandated it. So it's really good to see.
Can I ask you for an update on the your investigation into what happened in Badco in regards to letters from an MP being given to motorists when they were given a fine for doing the wrong thing on the road?
Look, I can't elaborate on that. As you would have picked up from parliamentary estimates, I recognise the information being supplied in the estimates process as constituting a police complaint. I've formally initiated that as a police complaint, so I won't be making any further comment on an active police investigation.
And when it is complete, will we get a result publicly on it?
Potentially not. It's within my discretion under the Police Complaints and Discipline Act as to whether or not I disclose information, so I wouldn't forecast that I would. It will be dependent on the circumstances.
Why wouldn't it be in the public interest?
Well, that's a matter for each particular case that's investigated under that process, and I make that determination, and I wouldn't be drawn on whether I make it here or now.
Can I ask, there's another bad weekend on South Australian roads, and there's a new road safety campaign beginning. Do you expect that will actually make any difference to what's happening?
That's a really tough question, Alan. We make significant efforts to educate the community through a range of different media. This new campaign, I think, has a very compelling story that we share with the South Australian community, the road users in South Australia. We've tried hard-hitting campaigns in the past. We've tried ones with a sense of humour attached. This one is, I think, a very compelling, sad story. We want people to think about the consequences of their road users, or whilst they're using our roads, and the potential for devastating impact on so many families. But you can't get past the fact that every single collision that happens on our road is because of a bad decision. No matter how significant that decision is, but these things come back to poor decision making, lack of concentration, lack of attention to the duties of driving. And we just encourage people to be tuned into the task of driving their vehicles or motorcycles or whatever type of car, truck you're in, knowing that if you get it wrong, it can play havoc with your life and others.
Commissioner, could I just ask you, on the masks rule, I know there's no change to either school use or in public use. What's your sort of, what's your thinking going forward with the use of masks?
Look, I'll wait to see the health advice. The health advice today is very clear that it provides very strong protection for the person who is wearing a mask in terms of the likelihood of contracting COVID-19, but it also protects other people around us, because if we are wearing a mask and we actually have COVID, it minimises the chance of us spreading it to other people. So there are two elements here that mask wearing contributes to mitigating, and I'm just grateful people are doing the right thing at this point in time, and we'll keep the community advised about the need to continue wearing masks as we get that health advice.
Minister Wade, can I ask you about the ambulance service? Less than 50% of ambulance workers are vaccinated. Is this concerning to you? And I know that Professor Spurrier mentioned workers in red zones who aren't vaccinated won't be working in red zones or can't deal with patients who have COVID. How do we implement that? Because how do we know if a patient has COVID or not? We saw someone get taken to a hospital just the other week.
So in relation to vaccinations, the government is very keen for all South Australians to get vaccinated. The latest advice I have is that 45% of our ambulance officers are fully vaccinated. We want to make it as easy as possible for health professionals to get vaccinated. So any SA ambulance officer who wants to be vaccinated can go to any of our mass vaccination clinics, the 3 metropolitan clinics, and without an appointment, on a walk-in basis, and be vaccinated. So we'd encourage all ambulance officers to take up that opportunity. But let's be clear, vaccination is not mandatory, and we only had today advice from a healthy employee organisation stressing that they did not support mandatory vaccination across the health workforce. In relation to the Red Zone initiative, SA Health is very keen to protect our employees, protect our patients, and protect the community from the risk of transmission. So as of the 4th of August, there will be a directive in place which means that a health professional who may come in contact with a COVID positive person will need to be vaccinated. That will be for the individual health services to manage. It certainly won't be without challenges, and I'm sure that there'll be teething problems. But I should stress it's not, should we say, a red zone in terms of a physical area. It's a red zone in terms of a patient pathway. So only when a COVID positive person is present is an area a red zone.
And so I guess, like the other week with the man who was taken to Modbury Hospital, we didn't know before he got to the hospital that he was COVID positive. So how will you be able to determine in the future that a patient is COVID positive or considered it to be in the red zone, and which ambulance officers would respond in that case?
So this is why the ambulance service and the health department have been working together closely in terms of planning for the August the 4th. And my understanding is that the ambulance services is confident that they'll be able to manage those challenges.
Have you spoken with David Place or anyone in the ambulance service about why there is this anti-vaccination mentality coming out of the ambulance service?
Well, Mr. Place came back from leave today, so I haven't had a chance to speak to him. But I don't think there is an anti-vaccination attitude in the ambulance service. The fact of the matter is ambulance officers are busy. We want to make it as easy as possible for ambulance officers to be vaccinated. That's why we've made it available on a walk-in basis to ambulance officers at our 3 major metropolitan clinics.
Minister, are you happy with the vaccination rates overall?
Nicholas Spurrier, I think, spoke for the whole government by saying we want to see every South Australian vaccinated. We obviously are keen to deploy vaccines as soon as they are available. We're all looking forward to the last quarter when we have significant increases in Pfizer supplies. But it has been clearly very disruptive to the national vaccination program, with the need to recalibrate the advice on AstraZeneca. But the governments of Australia have done the right thing. We've backed our clinicians. We've adjusted the vaccine program so that it is as safe and as effective as it can be.
Premier, could I? Sorry to call you back up again, Premier. But do you support the rollout of a vaccination passport, so to speak, or a vaxport for people, and to be able to give greater freedoms to people that are fully vaccinated?
We're certainly working at the moment at the National Cabinet level and here in South Australia on a vaccination passport so that people can demonstrate that they have been vaccinated without referring to the Australian Immunisation Register and carrying pieces of paper around with them. Now, I ultimately hope that we can actually link this to the sa.gov or my sa.gov app, which the vast majority of South Australians know how to operate, so that would be really great. As to what it will allow, I think that down the track we're probably going to have a situation where airlines are going to have to, people are going to have to demonstrate that people have been vaccinated. We haven't determined those rules here in Australia yet, but I do note, just with some of the social media that's occurred over the weekend, that in nightclubs and different hospitality settings in Europe, UK, and also the US, now we are seeing the licensed premises themselves saying, well, look, actually, we need to see proof that you've been vaccinated to gain entry. Now, these things haven't been considered in Australia yet. We would like to have a methodology for being able to provide proof of vaccination, but that is still also sometime down the track.
Would you support anything like, you know, what you're saying that is being rolled out in Europe, that, you know, no jab, no beer, for example?
Yeah, well, look, I just think it's too early to state what that's going to be, and I think that the more that we move in a consistent national basis on these types of rules, the better. I have seen out in the media that certain people say, well, this code, we want to have everybody vaccinated to attend matches. Now, look, that's something that I think we've still got to get quite a long way down the track before we determine a national position.
And can I follow up on hitting phase B?
Yep.
I know timelines can be a bit politically vexing, but can you give South Australians a date on when you think you might get to?
No, look, it really is all depend on one thing at the moment, and that really is the availability of those doses. Now, I think the federal government, Lieutenant General JJ Fruin, has done a great job at bringing forward the Pfizer doses, so we are seeing more sooner. And there could be further movements in that. The more Pfizer doses we have available, the faster we're going to vaccinate. Because at the moment, demand is greater than supply with Pfizer. Supply is greater than demand with the AstraZeneca. So we have a situation which is a little bit complicated, far more complicated than when we first designed the vaccination process in Australia. But we were, of course, thrown those two curveballs with the change to Targi advice, and then of course recently there's been a further update to that for people that are in Sydney. So look, it is what it is at the moment. We've got to just make sure that we have the systems in place that when those additional Pfizer doses become available, we can move through as quickly as possible. What I'm seeing at the moment is a reduction in vaccination hesitancy. So if we go back, at different times through this process, we've had people quite anxious about vaccinations. I think what we're seeing now is as more and more people go through the cycle, more and more people visit one of the mass vaccination clinics, or maybe their GP, they have a positive experience, they're telling some of their friends, their family might have hesitancy, and that's encouraging them to go forward and book. So the biggest constraint at the moment though is not hesitancy, it's actually the availability of the Pfizer doses. And as I said, I'm really pleased because later this month we have a very significant increase in that Pfizer dosage coming in.
Last week you said that the Royal Show is 4 weeks away. How do you see that successfully going ahead at the moment?
Well, obviously we're very concerned about any mass events in South Australia at the moment. The Royal Adelaide Show is just such a highlight on our calendar. They've been working very, very closely with SA Health to put a COVID management plan in place. Of course, we're very disappointed to hear that the Royal Melbourne Show has just been cancelled for this year, and there's great concern about what might happen now up in Brisbane. But at this stage, we're continuing to work with the Royal Agricultural and Horticultural Society for the Royal Adelaide Show this year. It probably won't be exactly the same as it's been in every other year because we do have to be mindful of this variant. And as I said, SA Health is working with a range of people at the moment with regards to their events, one of which of course is the footy this weekend.
Just one more on tourism support. Last week you said you and the Treasurer might consider further support for businesses that are still suffering or still can't open, like nightclubs. Where are you with that, and do you think there is any extra business support available for those in those sectors?
Well, I don't have an update for you today on the number of cash grants that have been handed out, but I know that on Friday they were sky high. We had other applications that came in over the weekend. Our focus at the moment is to get the $3,000 and the $1,000 payments out the door and into people's pockets, into their cash tills as quickly as possible, and then of course working with the federal government to process those COVID disaster relief packages, the 600 and the 375. We'll evaluate the situation in South Australia over the coming weeks. I think we've proven from day one that we've been able to move quickly and be generous relative to the rest of the country. We've moved very quickly with regards to these cash payments. We think that the business cash support that we've already offered is around $100 million. It depends a little bit on the uptake, but around $100 million, and of course the Treasurer hasn't ruled out further support, but we'll just evaluate that over the coming weeks.
Thank you.